My name is Lisa Hansen, and I am a PhD and licensed marriage and family therapist. I'm the clinical director at Flourish, which provides counseling to the Encircle House in downtown Provo, the LGBTQ Family and Youth Resource Center. Sex is biology, physiology, DNA, internal and external reproductive organs. Gender is social. Culture, how we construct the presentation or the internal awareness. There's both internal gender and expressed gender. People seem to do better when those match. They may or may not match what people assume to be DNA or physiology sex. Often it presents before puberty. Sometimes children as young as 3 or 4 will have very strong feelings about being in the wrong body, or body parts don't match who they feel they are. But gender dysphoria can also appear in adulthood. Most cases of distress in children resolve before puberty, and people who identify as gender dysphoric in childhood predominantly identify as gay rather than trans in their adult life, later on in their adult life. But a significant number still carry the puberty, intensifies the distress rather than resolves it. There's lots of different kinds of anxiety that occur when there's a mismatch between internally experienced gender and how the world responds to your gender. Social anxiety, generalized anxiety disorder, phobias of various kinds. Lots of things happen when there's just a mismatch. I've described it to parents who watch their children going through this as the rug's been pulled out from under. There's no sense of, I can be who I am and people respond to me as I am. It's like everything is tilted sideways in a permanent way. Well, I tend to work more with teens. I'm not an expert on childhood, but I work more with teens. And I would say 50% of the clients that we see here at Encircle would identify as gender dysphoric. The typical presentation is an initial withdrawal from the teen's world. That is, somebody who is doing well in school, doing well with, maybe a little bit introverted, but suddenly seems to take a nosedive, has difficulty functioning in ways that functioning was okay before. So parents typically say something with anxiety and depression is going on with my child. And then if the parents are open to it, the child begins to coalesce around something that's happening inside. It's almost like what happens inside an egg. You can't watch it happen. It seems like nothing is happening, but the identity begins to coalesce. That seems to be typical. I should also say, with regard to comorbid disorders, it's also interesting that in addition to the internalizing anxiety and depression, children and teens can also have externalizing behaviors like oppositional defiant disorder, which may make some parents or even clinicians believe that the gender dysphoria is a way of punishing, or a way of rebelling, or a way of expressing some dissatisfaction with the world, when actually it's expressing dissatisfaction with the internal world and it's coming out in those ways. So that's something to watch out for and not be triggered by, and to treat it in empathetic ways rather than treat it in behavioral control ways. The people who identify as trans do have a higher rate of lifetime attempts at suicide than any other diversity group that I'm aware of. The best research suggests that this comes from stigma. It's hard for those of us whose minds and bodies go together to recognize how disjointing it is, how disconnecting it is from most of our social life to not make those connections, that doesn't go smoothly in the mind and heart and brain and body. And having people recognize that your felt gender is different from the assumed gender of society makes people in general not know how to relate to you, and so you become an other. And as people recognize that they have become an other to people that formerly they were not an other, they were actually a belonging, the stigma of that being an other is particularly hard to bear. And the trans people go through periods of hope and connection, and then do periods of despair and disconnection. And as you can imagine, it's the periods of despair and disconnection that are associated with the depression that intensifies the risk of suicide. The very best treatment for gender dysphoria in children is to have children have a variety of playmates who are not othered, that everyone's gender expression is welcomed, because that makes life safer for everyone. And in the same way that we know that schools that provide GSAs, gay straight alliances, have fewer suicides, both of LGBT people and of straight people. We know that providing an open arena of what you express as far as your way of looking at the world and the way you see yourself, when safety is provided for non-conforming people, safety is provided for everyone. So that's the very best social treatment. Clinicians who can help normalize that a child may exhibit gender non-conforming behavior and relieve distress by associating with others who have similar symptoms, a similar constellation of symptoms, because normalizing it allows a child to figure it out better than stigmatizing it. Or so many children have memories of parents expressing negativity, expressing harshness, expressing don't do this. And that, of course, it doesn't help a child normalize and then be able to move past. Children can get stuck, just like the rest of us can when they're punished. Treatments also involve for people who, for pre-adolescents who are absolutely certain and for whom the dysphoria involves at least 6 of the 8 characteristics, hormone therapy seems to be helpful, both as a relief to not have puberty intensify what's wrong with one's body, but also there seems to be something in the brain that is relieved by hormone treatments. I've seen it in many patients who are experiencing depression, experiencing anxiety, relieved by therapy, talk therapy, relieved by social experiences, and then substantially relieved by hormones that match the felt gender. For some people, no therapy other than social therapy seems to help. That is, They don't seem to need hormone therapy, or they don't seem to need surgery. They just seem to need social acceptance. Then there are others for whom hormone therapy is the primary method of achieving resolution of distress, and they don't need the other possibilities. And then there are some for whom social transition, social acceptance, hormone therapy, and surgery, what we call top and or bottom surgery, are essential for their resolution of distress. So those are all options, but there's no one protocol for resolving distress. It's a matter of finding out where the distress comes from, and there's just a variety of how distress is resolved through one of those three, or two of those three, or all three of those three treatments. Exactly. It has to be individualized. It has to be custom, because there's as many different kinds of gender dysphoric experiences as there are people. Number one, don't trivialize anybody's experience of gender. Our cultural history is replete with trivializing people's experience of gender. If a boy expresses that he feels like a girl, that's trivialized in so many ways in our history. And it's a little easier for girls who feel more masculine, because our culture has allowed women to want to be men, but our culture doesn't allow men to want to be women, which is really interesting, because gender dysphoria shows up in children between 3 times as much as for boys, and 6 times as much for boys as girls. So it's sometimes between 3 and 6 times as much. So boys experience gender dysphoria much more than girls do in our culture. And that may be because our culture allows girls to express, to dress like boys or to act like boys, as our culture has set it up. But we're as a culture less tolerant of boys acting more feminine as we have defined it. So number one, don't trivialize anyone's expression of what is happening for them gender-wise. That's number one. That's something for friends, enemies, as well as institutions and families, and that's number one. Number two is if you have someone who is experiencing distress but not able to talk about it, it's okay to ask. Does part of you feel like a girl rather than a boy? Or is there part of you that wishes you could act more like a boy than a girl? If you have a teen who's asking to go by a name that seems to belong to a gender this person doesn't seem like, go along with it. There's absolutely no harm, and unless they're trying to get away from some. I mean, the only reason the court worries about it is if people are trying to avoid responsibility or debt, so we don't really look at that in children. Supporting a child's chosen name, chosen identity has been shown to actually increase their mental health. So it's, of course, troublesome to schools to do that, but actually really, really helpful to kids to feel like that identity is supported by teachers. So those are a couple of possibilities.